Hey there, and thanks so much for joining us. I'm Heather Sullivan with Sullivan Smart Sense, and today we're going to talk about something that I know so many people always have questions about, and it's such an important thing. We want to make sure that you have all the answers that you need. We're going to talk about the Affordable Care Act enrollment. The period is going on, what changes you need to know about, how it can help you save money, especially right now with so many people dealing with inflation and higher costs of living. We know a lot of people will be interested in this opportunity for health insurance in case maybe you had to cut back on your health insurance, or you just need to make sure that you're covered. So we brought in an expert today. We have got Lamont Thomas with Aetna joining us. Thanks so much for being with us, Lamont.
You're welcome, and thanks for having me.
Yeah. Okay. Well, let's just dive right in. First, let's just talk about the enrollment period. What are the dates that it's going on?
It's going on right now, and the date that it ends is January 15th. So there's about 2 weeks left in the enrollment period.
Okay. Well, let's just talk a little bit about, for anyone who's maybe never enrolled before. First, what are the qualifications to be able to enroll?
Well, you look at people that are working part-time, and they may be working part-time at companies with or without benefits, so there's an opportunity for them to enroll. Individuals that are business owners that may not have employees. Also, people that may have retired early before they're eligible for Medicare, so there's availability for those individuals. And those that, there's a lot of folks that freelance and are consultants, so there's an opportunity for them to enroll in the ACA programs.
Okay. Well, let's talk a little bit about first how this can help people save money, especially right now. Times are really tight. Like I said, I think a lot of people will be looking at this option maybe that hadn't looked at it before. How can it help them to save money?
There's great opportunities, a broad range of plans that are available. And there are some programs that people may be eligible based on their income level for subsidies and tax credits as well. So I think there's opportunities there. I think the first step for people to do is to really go online and look at healthcare.gov as well as aetnacdshealth.com and look at those websites and start doing some looking at information that's available to them. And what's nice about the ACA is that no matter where you enter in from an internet standpoint, there are navigators, local navigators and advisors that can help you, because that's critical. It's really having people to help you through the process and answer questions like, what's my healthcare needs? Do I have a chronic condition like diabetes that I need to manage? Or am I relatively healthy and, I'm good with just my, benefits and preventive being covered and things like that? So there's those kind of questions you can ask and think about my doctor, what's my network, and going in network, questions like that, looking at your prescription usage. So those are kind of questions you can look at and find answers to online, but also using a navigator and really help you towards driving what makes sense for you and your family, and really your financial situation can be covered based on those plan needs.
What in general does the plan cover? Like, does it also include, emergencies, checkups? Like in general, what can people expect in terms of their coverage?
They should expect prescription drugs coverage, pediatric services, women health services, mental health and addiction services, preventive and wellness, as well as emergency lab tests. So really comprehensive coverages that individuals can expect with ACA benefits.
Okay. And now in terms of, let's look at the cost versus how do you sort of decide which plan is affordable for you, that is going to work for you financially?
Yeah, and I wish I could just give you check this, check that, and give you this plus this equals that. But it really, you think about your income, where you look at subsidies, and it's usually between 100 and 400% the federal poverty level. So if you're an individual that falls in that range, there are benefits that can be free. It can be up to being free because of the subsidy. And then there's others that may not, because they don't fall within that subsidy range, and it may cost a little bit more. But there are benefits within the ACA that you can look at. And again, it's really understanding your needs as an individual and looking at those plans that fit your needs. Because sometimes you go in and you look at the biggest network available, but that's expensive. But if I look at where my doctors are, where I get care, whether it's close to home or close to work, then you can make different decisions that have an impact on your cost.
What are common mistakes that people make when they're enrolling?
I think the biggest mistake that we make as individuals make is not asking questions and just going in and assuming. I think this is an opportunity where people can just ask questions, take advantage of the information that's available, but you don't have to do this alone. There are navigators and advisors. Use them. There are no stupid questions. Ask questions specific to you and your needs, and think about it's an affordable plan for me. So how does that work for me as an individual, but also, and when I think about it, needs for my family? What are those needs? And I think that's the mistake people make. They don't ask enough questions.
Are there any changes, anything new or different this year people need to know about?
Not specific to the plan, but I think if you start looking at it, there are probably individual companies like Aetna, CVS that are entering into different markets. So there's more choices that are available. So I think that's helpful that you have more choices. And I think you're starting to see a lot more understanding of the plans where you get, and truly as it applies, more affordable. And I think there are more options around affordability that exist for folks. And I think one of the things that I want to reiterate or mention is that affordability doesn't mean lack of quality because it's inexpensive. My quality is there. I think with the Affordable Care Act, a lot of focus has been placed on quality and that you see a higher level of quality than you've ever seen before in the healthcare environment.
Okay. And so if someone is just getting started, how can they get started? How can they find some more information?
And I'm going to point back to going on the websites that are mentioned, the Aetna CVS Health and the healthcare.gov sites are two options to go on. And don't be overwhelmed when there's like information that is like, oh, wow, where do I start? I think you go on those sites, click Navigator and put in your zip code, and you'll get someone local to help you through what's happening, what's available to you local within your community. And that's where I think that's where everyone should start.
Okay. Are you hearing like from people, that talk about with the current economic environment, they're struggling. They're looking for options like this that can help them, make sure they have coverage and make ends meet.
Yeah, I think that's top of everyone's focus right now as individuals that, okay, where's my trade-off? My health versus maybe rent or versus groceries. But I think folks are looking at this, and I think those are options that are developed on the ACA that really provide a balance. So you may say that, again, as I referenced earlier, I may not want to go for the option that has everyone in the network. I may, because of my spend and what makes sense for me, may go with a smaller network, but it has everyone that I need in that network. And that's where I start and go in and to create that affordability for me within my budget as an individual or as a family, so that you don't forego healthcare and risk the chance of going into the system at a much more costly place because you forego the preventive care and engagement that happens with having insurance.
Yeah, absolutely. And I'm so glad that you mentioned all of that because we don't want to see people going without if they don't have to, because we know it's such tough
Absolutely.
times for folks right now. So Lamont Thomas with Aetna, thanks so much for being with us, really sharing a lot of great information. We appreciate it. We want to show people again, you can go to healthcare.gov there on your screen, or you can go to the Aetna site, which is aetnacvshealth.com. So Lamont, thanks so much for being with us. We really appreciate it.
It was my pleasure to again, thanks for having me and thanks for sharing this valuable information with the public.
Absolutely. And thank you to all of our viewers out there. We really appreciate you joining us as well. Hope that we answered some questions for you if you are navigating that ACA enrollment. Again, it is going on right now. So go ahead and take a look at those sites to get more information and see what kind of coverage is available for you and your family. Thank you for joining us here on Sullivan Smart Sense. If you have any other financial questions or issues you'd like us to cover, just send those my way and we will cover them. Thanks so much for being with us, and we'll see you next time.